Hi friends, here are some tips to help you avoid cesarean during birth. So having a birth facility that has a low cesarean rate that you're going to birth in or birthing at home and choosing a care provider who has a low cesarean rate will significantly impact your cesarean risk. So this is because care providers and birthing facilities who have low cesarean rates tend to support people in having more normal physiologic births and tend to take more steps to supporting people in decreasing their risk for cesarean. They probably have more policies in place that are more aligned with current evidence and support people in having longer labors, for example, or birthing in upright position, and they work well with doulas. And that is the kind of provider and environment that you deserve. The next step is to avoid non-medically indicated ultrasounds at the end of your pregnancy. So there are several different ultrasounds that will be offered to you in a traditional care provider setting throughout your pregnancy. There's the early dating ultrasound, there's the anatomy ultrasound around the middle of pregnancy, and usually at that point, a lot of care providers will not ask for any other ultrasounds unless there is a medical indication. But there are many providers, especially in the OB model, who want their clients to all get a growth ultrasound around 32 weeks of pregnancy. And a growth ultrasound is not medically indicated, but it is routine and it's part of standard care, even though there really is not a lot of benefit that comes from it. The thing to be aware of with this is that if you get an ultrasound in your third trimester of pregnancy and someone tells you that your baby is measuring big, the chances are that your care provider is now going to have some bias around big babies. And we have a lot of research on this that shows that care providers who have bias around big babies and who believe that your baby is big are going to treat you differently compared to someone who they believe has a small or average size baby. So this means that it's statistically more likely for you to have a shorter trial of labor and to be induced because you have a suspected big baby. But the thing about ultrasounds is that half of the time they're right and half of the time they're wrong. So they're only accurate at identifying fetal weight about 50% of the time. So that means we will be giving a lot of people shorter trials of labor, cesareans, inductions of labor, etc., for having a suspected big baby, and it turns out that baby is not big at all. So if you want to decrease your risk of having a cesarean, avoiding those ultrasounds and avoiding the large baby bias is huge. Next is to use intermittent auscultation during labor instead of continuous fetal monitoring. So there are many different ways to monitor your baby during labor. This is to monitor their heart tones, to know that they're tolerating labor well. So there is a little monitor that can be attached to the baby's head for internal monitoring. This is continuous monitoring, so it monitors baby continuously throughout labor. And then there are those straps that wrap around your belly that can monitor baby's heart rate throughout labor continuously as well. Both of those forms of monitoring also monitor your contraction frequency, but only internal monitoring can monitor the intensity or the level of strength of your contractions, which is often not a necessary thing to know. So intermittent auscultation is a way of monitoring the baby instead of continuously, just intermittently throughout labor. And this is done when a care provider uses a Doppler and places it on the belly in the area where the baby is, right over their chest to listen to the heart rate. And they'll listen for just a little bit to be able to count out the heart rate and make sure that it's in the normal range, which is usually about 110 to 160. Some care providers will monitor every 30 minutes and others will every 15. Often when someone is pushing, the care provider will want to monitor a little more closely, like every other contraction or every 5 minutes. Every care provider is a little different in the way that they use a Doppler. This is how midwives in out-of-hospital birth settings monitor babies' heart rates. And the research that we have on this topic says that intermittent fetal monitoring does not decrease outcomes for babies, but it does increase cesarean risk. So there is no negative impact on baby to monitor them intermittently, which means that monitoring continuously is not necessary. And the only thing that continuous monitoring tends to do is increase the cesarean risk by 19%, which is pretty significant. Next is your position. The positions that you assume throughout birth will impact the blood flow that baby is receiving. And as baby is well oxygenated and receiving adequate blood flow, they will be able to have strong heart tones. But if the cord is compressed in a certain way, or if you aren't receiving adequate oxygen, that can impact the baby's oxygen and the baby's heart tones. So when you are lying on your back, there is a blood vessel that runs under your uterus. And when the baby in your uterus puts pressure on that blood vessel, it can constrict blood flow to you, which which decreases oxygenation for you, which can then in turn affect the baby's oxygen levels and the baby's heart tones. So being in upright positions, especially during the pushing phase when you're pushing the baby out, can really help the baby tolerate labor well, and that can decrease your risk of having to get a cesarean due to fetal heart tone concerns. Upright positions look like standing and squatting and sitting on a birth stool, kneeling or lunging, and also hands and knees. In addition to that, moving throughout labor significantly increases your baby's ability to move through the pelvis by opening up different spaces in your pelvis and allowing the pelvis to take on many different little orientations. And that supports the baby in doing the movements that they need to do to be able to work through the pelvis. If baby becomes a little stuck in one area because you are only staying in one position, that can impact their ability to move through the pelvis, and that can eventually lead to them not being able to tolerate labor well. It could also lead to labor being longer and more uncomfortable. The last is to hire a doula. We have found that continuous support throughout labor, which is obviously what everyone deserves, is seriously one of the best things you can do to help you cope with labor, to help you decrease your risk of cesarean, decrease your risk of all other interventions, and so on. People have much happier experiences with doulas because they're getting continuous support throughout labor, which is what they deserve. And if you want an unmedicated birth, having the support of someone who has done this before and who is there to use all of their tools to support you in having that experience can greatly impact your ability to do that. Doulas often give their clients guidance on all the different positions that they can assume in labor, and that can support baby's progress, and it can also keep someone off their back and encourage them to move throughout labor. Or if they have an epidural, doulas can also support the person who is laboring in getting into different positions, even with the epidural, to help keep the baby from applying pressure to your aorta and also support them in navigating the pelvis in a good way. Also, care providers are much less likely to abuse someone in the presence of a doula, because sometimes care providers want to perform a cesarean for their own convenience or for financial incentive, but oftentimes cesareans are not recommended out of the well-being for the mother and baby, but for other reasons such as convenience and so on. So having an advocate there who is going to stand for your vision, your preferences, and support you in making that happen can significantly decrease your risk of having a cesarean. I hope this helps. You've got this.